Bismillahirrahmanirrahim. Our talk today about preparation for teaching in academic setting. Before we starting our talk today, we are go back to memorize what we are already discussed in the previous lecture. In the previous one, we are talk about 4 questions by Ralph Taylor, program philosophy, and platform of Walker Decker. All of these are integrated together to give us a productive and effective curriculum. In addition to that, we are discuss different type of curricula: explicit, implicit, and non-curricular. So now the objective of this lecture will be going through identify and discuss characteristic of 5 different philosophical orientation to curriculum design, and give a specific example of how each apply to physical therapy field. Next one, describe 4 broad categories of learning theory that are based on different view of how a student can learn. This may be in the form of behaviorism, cognitive learning theory, problem solving, social culture learning theory. This may be explained by give a specific example of course material that could best be taught by using each learning theory. One more objective for this lecture will be about discriminate among 3 major learning domains: cognitive, affective, and psychomotor, by citing elementary to complex level within each that can be used to guide design of course content and the assessment of the student learning. The 4th objective for this lecture will be about identify the 4 learning styles described by Klopp and give example of the student behavior that may be manifest by high and low interest in each learning style.
Discuss construction of and specify the use of 3 different types of objectives that can be used to guide student learning: behavioral, number 2, problem solving, and outcome. Number 6, demonstrate how the delivery of course material and evaluation of the student is linked to philosophical orientations, learning theories, learning domain, students' learning styles, and course objectives. Also, from the objectives of this lecture, list the items that could be included in a course syllabus and prepare a syllabus concept map that demonstrates the linkage across course key concepts.
So to start our talk today, you are going to explain how we are going to get ready to teach a class or course for the first time, and almost always as pre-practicing situation. So where we are going to start? Educator have to suggest 3. There are at least 3 kind of knowledge essential of teaching effectively. What are those 3? First one, knowledge of the subject matter, knowledge of the subject to the learner, knowledge of the general principle of teaching. This is concept of knowledge pedagogy. So the lecture presents an overview of the type of knowledge that the physical therapy educator are most often missing: knowledge of pedagogy. Okay. So we start by pre-active and interactive teaching, were coined by Philip Jackson. Pre-active, what is meant by pre-active? Pre-active means teaching refer to those elements one when preparing the teacher or the course. This is not actual teaching, but the setup for the teaching process. Interactive means teaching refer to what happened teacher is to face with the student. This is the actual process of teaching, when the teacher or the professor are facing the student, whatever this facing may be online to introduce his subject, or by face to face in the classroom.
Such activities include reading background information, preparing course syllabus, developing media, and even arranging the furniture in the classroom. These activities are highly rational. That is, the teacher read, weigh evidence, reflect, organizes, related the current class content to past and future classes the students are involved in, and create also the optimal environment for learning. Like the first year teacher who was grappling with how to organize a 1-hour lecture. Most of these activities occur when the teacher is alone and in an environment that allow for quiet, deliberative thought. The teacher, when preparing himself for a pre-active or when he preparing for designing a lecture, it has to have a time for himself.
You mean the teacher will set up for the classroom?
Yes,
Okay.
yes. The pre-active preparation allows the teacher time to think through the breadth and depth of information that is to be presented. He will present what? He presented knowledge. For whom? For a particular group of students. That means for the learner, as well as the most coherent and understandable way to present the information. What is meant by pedagogical knowledge? That means it has to be in some way have the subject knowledge and the learner, which give them the knowledge, and also the knowledge for pedagogical. What he will be used? He will be used with computer. He was using clinical setting, case study, whatever he has. He must be prepared before he starting to stand in front of the learner. By contrast, interactive teaching referred to what? Referred what happened when the teacher is face to face with the students, as Dr. Fatin said before. Interactive teaching activities are more or less spontaneous. بمعنى, when working with large group of students, the teacher tends to do what he or she feel or know is right. What will be happen if it is in a shouting milieu of a classroom, laboratory, or clinic? Little time is available to reflect on what are appropriate and useful teaching strategies.
So now it becomes more clear, as we mentioned before, experienced teachers are considerably more skilled in interactive teaching and reflection in action than novice teacher. That's to say, we are here, we are going to dealing with too much time before with experience with its basic element, how to be effective teaching, as we mentioned in the previous lecture.
This is similar to experienced clinicians who seems to know the right thing to do with patient with an ease and confidence that amazing novice clinicians also.
Thoughtful pre-active teaching. What is a pre-active teaching? It is a preparation can allow even the novice teacher, in the previous slide we are talking about who has a long time of teaching. Now we discuss novice teacher, the freedom to focus. To focus on what? In the student understanding and learning, rather than remain tightly tied to one lecture notes. So may be flexible. What is the way this student can be free to understand, to gain more skills and
Pre-active teaching elements are covered in these lectures, while we will focus on interactive teaching elements will be next lecture inshallah. In pre-active teaching grade, what is the meaning of pre-active teaching grade? The pre-active teaching grade is grade بمعنى شبكة. It is useful for designing a whole course or a single class. When all components of this grade have been identified and related to each other in a coherent fashion, the delivery of the course content also tends to be coherent to students and to the teacher. So, the pre-active teaching grade is used to give information for the teacher how to design, what are the format of delivery, lecture, laboratory, what are the teaching environment will be used, how can be evaluate these teachers, these students, a teaching aid, what type of learning theory will be used, and philosophical orientation. So the teacher is extraordinary component regarding the subject matter to be taught, which is the knowledge, and is physical therapist who has a good knowledge of the students to be taught and what information they need for a competent clinical practice. To organize and present material in a manner that is responsive to the program mission and desired student outcomes, the teacher must be urged to think through the component identified in the pre-active teaching grade. As we explained, this is a teaching or pre-active teaching grade. As we said, it is useful. Useful for what? It's useful for designing a whole course or a single class. Why? If we looking for the table, it consists of a vertical column consisting the upper part of the grade, and there is a second part, or the lower part of the grade. The upper part of the grade concerning of what? It is consists of physiological orientation, which is the first left vertical column. What is the physiological orientation? What is the second column called about? It talk about the learning theory, and the other one on learning. All this we'll talking about later. So the grade is consisted of two parts, upper part and lower part, or the top part and this is the upper part of the academic setting, or the grade, which consists of the upper part. This is the upper part what we see. In the vertical left column, there was a philosophical orientation. Philosophical orientation consists of cognitive processing reasoning, academic rationalism, technology, social reconstruction, and personal relevance, and this will be talking about later. The next column is learning theory. What is the learning theory? There are three main learning theory: behaviorism, guest-led problem-solving experience, and baked cognitive structure, and also the domain of learning, the third column, vertical column, which there are a 5 cognitive or 5 domain of learning, which is cognitive, affection, perceptual, psychomotor, and spiritual. The student learning style, what we will use, what style the student will be used: active experimentation, abstract conceptualization, reflective observation, or concrete experience. And the last column will be the main one, which is objective. Without objectives, we can't do anything. We have to do right the objectives, like today. Today, when we starting our lecture, we starting with the objective. The objectives, what telling the learner or the students or anyone what we will expected from these lectures to be know after the end of these lectures.
So you mean for preparation for the teaching the student in academic setting, we must first of all the teacher. Who is the teacher? And the institution. What is the institution? What is the course? What is the program delivered for this student? Audience, and then class size, how many students in the class, and in which time we are going to teach or learn this class. This is the first one. If we are looking for the horizontal one: teacher, institute, audience, class size, and the time. What we are going to pick up from this table? As we considered before or discussed with Dr. Umayma, she talked about philosophical orientation. This philosophy, in which area we are going to organize or arrange our philosophy. Here we are going to discuss different area as cognitive processing and academic rationalism, technology, social reconstruction, and the last one, personal relevance. If we look for the percentage, what is meant by this percentage in the second column? This percentage must be complete the total or accumulative as philosophy, which percentage, which kind of the learning will be used, as institution represent learning theory, which one, domain of the learning, which what the amount of percentage must be clear for the student in different one.
يعني معنى كده ان البرسنتج ديت encourage the teacher to think through how much percentage in time and effort each of the element contributes to the presentation of a particular area.
This must be considered before while he is preparing for this class. Must consider which learning theory it is high or take much time or take a lot of objective to be achieved in this class. So maybe learning theory, maybe the domain of learning, maybe student learning style, all of this must be mixed, and each one represent percentage must be achieved throughout the lecture. If we are looking for the last column as objective, here we find 3: behavior, problem solving, outcome. This must be considered which one we are going to pick up for this lecture. It is a behavior, it is in the form of problem solving. It considered according to what style you are going to teach for the student, which theory you are going to apply to practice in this class. In the last table, we mentioned for preparation of the class, we have philosophical orientation. These philosophical orientation are 5 in number. It can be used to guide curriculum design. First one, development cognitive process. Next, academic rationalism. And then technology. What kind of technology you are going to use? And then social interest. This means social adaptation and the social reconstruction. The last point, personal relevance. As we explained before, in this lecture we talk about preparation for academic teaching. First point we discuss, we talk about 5 philosophical orientation. After we discussed, and I think it became clear for all of us, now we are talk about learning theory. How many theory we are? Theories about how people learn have been discussed at least since the time of Greek philosopher Plato, this before century 428 up to 347. Plato postulated that knowledge was innate, mean from inside, that implies the time of the birth. Since birth, we have ability to be learning, to gain a knowledge. The function of the teacher was to help the learner to recall what one's soul had already experienced and learned before. Nearly 2000 years after Plato, the British philosopher Jean-Luc, since 1032 up to 1741. Locke postulated the infant were born with the mind blank as empty paper. State tabula rasa. The teacher role was to provide experience that would fill this blank slot with the knowledge. How many theory you have? There are many ways to classify learning theory. We have a lot of names. We have a different category of learning theory. First one and the most common one, behaviorism. The second one, Gestalt problem solving experiences. The second one, Piaget, or as all of us consider and naming, cognitive structure. So if we're looking for this diagram, learning may be through cognitive, behavior, and through experience by environment, through solving experience through the environment. Here also the different, this triangle, in each one we have Gestalt problem solving experiences, or in some announced as Gestalt problem, behaviorism, and Piaget cognitive structure. Learning theory provide what? Provide the teacher with the idea about how to present a student with the different type of knowledge and skills. So you think we are going to use only one theory? No, we are integrated different theory together. So each theory can represent for some sort of or a part of teacher or class. So the teacher provide with the idea about how to present to student with a different type of knowledge through different type of theory, and also different type of skill through also many varieties of the theory. In this way, reinforces the underlying philosophy orientation the teacher is focused on. First one, we are talking about behavior learning theory. Behaviorism theory or behavior learning theory was developed in the first half of the 20th century as a result of numerous experiments, primarily on animal and birds, and then experimental psychologists by Thorndike and Skinner. As we see here in the left one, Thorndike, and the other one is Skinner. The basic theory of behaviorism rests on the observation that behavior that were rewarded, positively reinforced, could occur. Isn't whatever, and this all of us, when we have our infant, we, without even the people having any idea about any theory, we can find this parent can use this way. Positive reinforcement strong the behavior, while negative reinforcement it can weak the behavior. This already all of us we use with other our colleagues or neighbor or children or infant or whatever. Operant condition by B.F. Skinner developed in 904 up to Skinner lived from since 104 up to 1990. Elaborated Thorndike law of effect, developed behavior technology. That we are looking for. The first one developed by Thorndike and then developed by another behaviorism as Skinner. Behaviorism theory of learning. Teacher must learn how to teach. They need only to be taught more effectively way of teaching, this which is stated by Skinner. So here, if we're looking for this pyramid, determine human behavior, it depends on what? Environmental factors such as social norms, access in community, influences in the other ability to change on environment. The another one of the base behavior factor such as skill, practice, and self-efficiency. Cognitive factor, also called personal factor, knowledge, experiences, and attitude. All of this, for behaviorists, the process of learning involves rewarding correct behavior until behavior change is consistency and demonstrated. Physical therapists use behavioristic principle continually in patient care to teach psychomotor skills. For example, patients are reinforced with enthusiastic paresis for attempting and subsequently achieving self-care activity or get training. So here it's so clear for us when we are going to use behavior or behaviorism theory. We are going to apply this one when we are going to teach the patient self-care activity or whatever any component of ADL. So when we encourage, we reinforce the patient, this considered as a part of behavioristic principles that are used by physical therapists.
That say, patients are reinforced with enthusiastic praise for attempting and subsequently achieving self-care activities like Dr. Fatin said, such as what? Doing and defeating processes in the classroom, acquiring accurate knowledge. بمعنى knowing the right answer is rewarded by receiving high grade and praise from the faculty, while lack of responsiveness to acquiring this knowledge presented is quelled by poor grade and perhaps even failure to proceed in this program. Another example is the computer-assisted instruction, which is based almost and extensively on this learning theory. Students receive immediate feedback contingent on the accuracy of their responsiveness. Clearly, many psychomotor skills and specific facts that need to be memorized are successfully taught using behavior our behavioristic principles. For a teacher whose main philosophical orientation to a course is technology, remember that the predominant learning theory of choice would be behaviorism.
Clearly, many psychomotor skills and specific facts that need to be memorized are successfully taught using behavioristic principles. Children learn language step by step. How? How are gain language? First of all by imitation, then by repetition, then to memorize, and then control, drilling, and reinforcement for what is going already taught. So reinforcement can either be positive or negative. When we are taught in proper way, we can reinforce, we can reward. When the infant is going to speak in unpolite or unaccepted way, we can give him negative reinforcement. So we can use reinforcement either in positive way to strong the behavior, whatever behavior in like in this example, to gain language skills, or in any motor behavior, or even in any attitude or behavior. For the teacher who is within philosophical orientation to a course, is technology the predominant learning theory of the choice should be behaviorism.
That's what I said.
The behavior approach work well when teaching a skill with a measurable action. So here the action must be measured. This is our future. This how to gain, how to measure the skill in proper way. This is very important to gain accurate evaluation for the student as well as for the patient. So application of the behaviorism or behavior theory, we found it distributed and considered as one of umbrella for motor learning in physical therapy field. It's pronounced as Gestalt or Gestalt. This is a problem-solving experience. In the early of mid-19th century, Gestalt psychologist theory of human learning that it was diametrically opposed, so that the word Gestalt mean organization. Gestalt psychologists believe people experience and organize the world in meaningful or in context. So not in scattered, but anything must be have the meaning, not to be apart. The principle of learning in context clearly operates the clinical practice and academic setting. Physical therapists who in the past prepared the patient for functional activity by working in strengths and the specific muscle group now ascribe to the modern motor learning theory, in which teaching movement within functional pattern acquisition of motor skills. So this is belong or under umbrella of Gestalt. In academic setting, students need framework of information so that the function of muscle group in kinesiology classes and the learning assist patient to improve the function of muscle group in therapeutic classes as well. So it is become integrated. In this matter, students learn and understand the origin and the insertion of the muscle groups in the context of muscle function. The context of this use of this information in the patient care, thus of anatomical structure, is easier because it has useful context, therefore makes sense. So when you take information per se for its own, maybe not have a context, but when we are going to apply to beating function, as when we study anatomy and then apply through kinesiology, we know about different mechanics component, and then apply in therapeutic exercise, it become easy to correlate different topics, different courses to have a context or meaning. This is the way or philosophy of Gestalt theory. John Dewey, who has been called American greatest philosopher, expand on learning theory of Gestalt or within the context. He developed this theory. So Dewey describes the process of human problem solving reflective thinking, and learning in many slightly different ways. Why he is going to do something like that? Because he know the intelligent thinking and the learning is not just following some standard recipe. It never have a standard, but it may be changeable. He believed that intelligence is creative and flexible. We learn from engaging in a variety of experience in the world. In any situation or any event you find yourself, gain some information, maybe gain any skills, maybe accidentally. So learning not to be all the time as a system, and you are going to sit in the class to teach something or to learn something, but maybe anywhere, everywhere you can teach for even for our life. However, in all of this description, the following element always appeared in the some form. Thinking always get started when the person genuinely feel a problem arises. Isn't when I am going to think deep, when I am going to think outside my closed circle. Thinking always gets started when a person genuinely feel a problem arises. Then the mind actively jump back and forth. We find ourselves searching in our mind, struggling to find a clearer formulation of this problem. When we get any problem, we find all of the information from the back, from the history, come to our mind to try to solving this problem. Looking for suggestion for possible solution, surveying element in the problematic situation that might relevant, may be irrelevant, so discard, drawing in the superior knowledge in an attempt to better understanding this situation. So we find our mind being forming of action of hypothesis about how best problem might be solved. What is the best solution for a problem that I have? The hypothesis is then tested. If the problem is solved, then according to Dewey, something has been learned. So when we are reaching the solving of our problem, that by Dewey concept we have learning something new. This is a concept of Dewey.
That's why in the classroom and in the clinic, when teachers present students with clinical problem to solve, they are following the tradition of John Dewey. Perhaps even more important, Dewey illuminate how we learn from our experience in clinical practice. His postulation that learners occur from actively solving meaningful problems explain the accumulated wisdom of experienced practitioners that is far beyond the knowledge contained in the context or on the current textbook. Reflection in action and reflection on action described by Donald Scone, and it is elaborated later. While the present-day vision of this gaslit problem-solving learning theory that was first articulated, as we said, by Dewey. For a teacher whose main philosophical orientation to a course is development of cognitive processing reasoning, the predominant learning theory of choice would be the gaslit problem-solving experience.
Now we are jump to another theory, cognitive learning theory. The Jean Piaget since 1896 up to 1980, well-known researcher demonstrates the influence of environment on cognitive development of the children. Which children? His own children. And the stage of learner as he or she is developing cognitive schema. From this work of Piaget, the postulated that thinking and learning were bound to child biological development. Here, if you're looking for this cognitive domain, we find the cognitive domain printed with permission from C.W. Ford, a clinical education for allied health profession. Here, what is going to explain by cognitive domain? Here, talk about knowledge, comprehension, application, analysis, senses, and evaluation. This different area of cognitive domain and may be added one else as it's considered as 7 area. This also, when you are going to design any course or any curriculum, we use all of this domain to extract strong curriculum, not to be based on the knowledge only or the evaluation only, must be mixed. As we are in the lower level of education or in lower knowledge of cognitive domain, we are toward knowledge. As we are going to higher level, we are going to senses and evaluation. Here also, if you're looking for the figure above, below taxonomy, it have the same. It have knowledge, comprehension, application, analysis, senses, and evaluation. This is for development of the curriculum. Each one has a verb or different verb can be used to develop the curriculum, to build up our structure of the curriculum.
Elliot Isner conceived a development of cognitive processing, which is the first one of the 5 philosophical orientation. So, cognitive processing reasoning focuses on teaching students to develop and refine their intellectual processes, how to gather and analyze data, how to pose and how to solve problems, and how to infer, how to hypothesize, and how to make judgment based on limited information. So the concern of the educator is on the how rather than the what. Little emphasis is placed on acquiring facts because the development of cognitive processing and reasoning orientation possesses that by teaching students. Teaching students what? Teaching students how to think, reason, and how the teacher uses resources. They will be able to identify and locate, evaluate, and apply whatever information they might need.
To complete discussion of cognitive processing reasoning in a problem-based curriculum, the entire curriculum is composed of clinical problems. With any given patient problem, the student learns to seek out, to look for, analyze, and act on the information they need. Gather information from a variety of sources, including anatomy, pathology, therapeutic exercise, and the healthcare economy, because these sources relate to the patient problem under this consideration. By this process, the student is introduced to the cognitive process of inductive and deductive thinking and how both processes are used in healthcare decision making.
We said processes of inductive and deductive thinking. نرجع كده شوية للريسيرش ونشوف ايه هي deductive and inductive thinking. This is a scientific method of research called inductive and deductive mode of thinking. Inductive means what? Means movement forward from partially known, that means goes from a particular to the general, from the micro to the macro, from specific to the general, while deductive thinking means backward movement from the general preposition to a particular facts or data of experience. That say goes from general to a particular, from a macro to micro, and from general to specific. So the student could be presented with whatever he will solve the problem. If he will use inductive thinking or mode of thinking, or he will use a deductive mode of thinking. The students could be presented with a clinical problem that represent a moral dilemma. Analyzing such a problem involves cognitive processes of identifying the student's own value, comparing and constructing these values with a principles contained in a professional code of ethics and working out a rational, empathetic decision. As time to evaluate and treat patient has declined in all healthcare settings, teaching students must be think rationally, humanly, creatively, and quickly in time is time well spent in every course.
As we discussed physiological orientation, first one we talk about cognitive processing reasoning. The second one, academic rationalism. A philosophical orientation of academic rationalism focus on traditional area of the study that faculty think represent the most intellectually and artistically significant idea within the field they are teaching.
This approach relations the history and careful inquiry that have led to formulation of university principles and philosophical, scientific, and artistic concepts using today's words. بمعنى ان لازم ان انا اوصل لفورمه معينه ايه اللي العالم محتاجه النهارده، لازم اقدر اوصل بيه عن طريق البرنسبل of philosophical and scientific and the concepts which we use today, and this is academic rationalism.
In this type of orientation, more time is spent on the theory and less in practical application. So, when we are going to discuss academic rationalism, what is the rationale, what is the philosophy of this institute or university or department? Here, this rationale, more time spent in theory and less practical application. This is meant practical rationality. As Sina stated that the central aim is to develop man rational ability by introducing his rationality to idea and object that represent reason highest achievement. Obviously, no healthcare curriculum could be based solely in academic rationalism because too much healthcare information and related patient care intervention strategy are outdated within the decade or less. However, physical therapy educators struggle with how much academic rationalism to put into curriculum. So our example here, in neurological rehabilitation area, educator may grapple with how many students should be exposed to historical perspective such as what? What is the technique? Margaret Rood, Not, Berta and Karl Bobas, brainstorm. When we compared this with the time devoted to the current theory of motor control and motor behavior, we find a sequence for development of such techniques. So now all disciplines need linkage to what has come before them. Here we are going to discuss about historical development of different approach. Maybe one approach based in one another or what is going on. So historical roots and the context of discipline is an important dimension of professional history for fully understanding and addressing answer to questions the profession continue to face. So now we are jump to another point for philosophical approach. This we are going to discuss technology.
The philosophical orientation of technology focus on practical or technical behavior that the student should attain to become proficient in her or his field. Using this orientation, a curriculum or a course would consist of a series of clearly delineated behavioral objectives the student is to master. The underlying approach is essentially a stimulus-response reinforcement model. طب example لكده ايه؟ The computer assisted instruction is an example of this orientation. Computer assisted instruction is an example of this orientation. The answers are predetermined to be clearly right or wrong. The student receive immediate corrective feedback. Using a computer-assisted instruction, the student can repeat material until a certain proficiency level is attained. In physical therapy programs, there are many areas of content and skill knowledge that lend themselves to the technology orientation. As in anatomy as example, there are clearly right and wrong answers. So the anatomy are clearly right and wrong have an answer. Maybe the answer is wrong, maybe the answer is right. The teacher's task, what he will do, he's determine how much anatomy, at what level, and what approach can be used that will help students to memorize and to apply a material accurately. Practical skills knowledge such as the biomechanics of lifting or steps involving wheelchair transfer are also often taught using this philosophical orientation.
So we are talking about the technology, how we are going to use technology as one of philosophical for preparation for teaching. Social adaptation and social reconstruction. What is meant by social adaptation? Social adaptation, where we are going to develop curriculum orientation focus in what? Knowledge and skills. We must keep both of them parallel to each other. Maybe the percentage differ from the area to another area, but must keep both of them, especially keep knowledge when we are going to introduce new material, new information. So must have enough knowledge to go through the skill to be acquainted or gain the skill. So the student need to function in today world that is in what society need to maintain the status quo. So social adaptation under this orientation, for example, physical therapy would be taught the information and the technical skill that needed to immediately fill this area of practice with the greatest number of job vacancies. Here, what we are going to discuss in this area, when some therapists are in vacation, how we are going to, for example, in summer or in whatever the events, some of the therapists got to be in vacation, how we are going to overcome or to adapt these events. So, also related to social, we have another point as social reconstruction. The curriculum in identifying the changes, composition, and the project need of society and the skill that will be needed in the future to be responsive to these changes. So when we are going to talk about social, we are consider two elements. First one, adaptation, and second one, construction. So such a skill to gain, to overcome reconstruction might include working to change certain aspect of society. So social reconstruction is intolerance to ethnic and cultural differences, environmental pollution, and the rise of homelessness.
For example, in a physical therapy curriculum, students would be engaged in experiences designed to develop their tolerance for working with patients. Those heritage and lifestyles differ considerably from their own because involved in environment health groups or immerse participation in pro-porn services for the homeless. Thus, although social adaptation and social reconstruction have different aims, they are tied by the common
philosophical belief that society need should guide curriculum. The social reconstruction approach is one that would underlie a curriculum philosophy of a change of agency. Although many programs suppose such as outcome, one need to ask about what? Do the courses have learning outcomes that challenge the student in his direction or in their direction? So the last one we are going to discuss Personal relevance. What is meant by personal relevance related to philosophical orientation? This means focus in what the personally relevant to the student. What is the relevant? What is the close to the student? Personal relevance also probably the archetype of this orientation is prototyped as A.S. Niels Thomas Boarding School, founded in England in 1921 and designed to make the school fit the child instead of making the child fit the school. So now we are going to this is a philosophy must be clear for all of us. This acquainted to past history 1921 to make the school fitted to the child interest, not of making the child fit the school. This orientation is a challenge to entry-level physical therapy educators who have little enough time to teach group of students the basic intent and the task of their profession without responding to the individual personnel relevance requirement of each or such student. The most successful continuing education program appear to be those that offer clinician knowledge and advanced skill as in different technique of manual therapy. So in this situation, what will happen? What is going on? Immediately apply in an individual clinician healthcare setting.
The personal relevance orientation is very much in evidence in continuing education program as well as a post-professional graduate degree program. The most successful continuing education program appear to those that offer clinicians knowledge and advanced skills, for example in manual therapy, which can be immediately applied in an individual clinician's healthcare setting.
The most successful post-professional graduate programs appear to be those that offer the student a great deal of what latitude in what he chooses the pursues and where the faculty is dedicated to encourage and supporting students in their individual process. So our program must be not to be loose, must be in consistency, relevant to the student. So must a great deal to latitude and pursues with the student. So to using 5 curriculum orientation to guide curriculum design and the course development. So now we are back to the previous lecture when we are going to discuss curriculum design. Here curriculum orientation. We have 5 philosophical orientation model must be considered when we are going to discuss or to develop or to re-innovate the innovation for the program. These 5 philosophical orientation are, which you are just discussed. First one, development of cognitive process. Second, academic rationalism. Third one, technology. The fourth, society interest in the form of social adaptation and the social reconstruction. And the last one, discuss about personal relevance.
The first one, development cognitive processes. What we're talking about is it concerns the educator is on the how rather than what, gather and analyze data, pose and solve problem, how to hypothesize, how to make judgment on a limited information. Number 2, when talking about academic rationalism, it focuses about what? Traditional area of study that faculty represent the most intellectually and significant idea within the field they are teaching. The third one, technology, it focused on particular or technical behaviors that the student should attain to become proficient in his field. While social adaptation and social reconstruction, it is a curriculum orientation which focus on the knowledge skills students need to function in today's world, for example, society needs. This is the social adaptation, while social reconstruction focus on the curriculum on identifying the changing of or the changing composition and projected needs of society and the skills that will be needed in future to be responsive to these changes. The last one from the Philosophical orientation is a personal relevance. Philosophical orientation of personal relevance focus on what? Focus in personally relevant to the student. How? I think we summarize all the 5 philosophical orientation, and which everyone or what every one of these items or the 5 items concerning of.
Mean concerning of how to develop a curriculum, or our discussion regarding for preparation for what? For teaching for what? To develop a curriculum, to develop effective curriculum. So in working with the entire curriculum design, the 5 philosophical orientation can be used to review the multiple courses that make up the curriculum, identify what philosophical orientation the curriculum emphasis is built on, and enjoyable and often revealing activity for individual faculty as well as collective faculty. It will be clarify the faculty own value and belief about the mission, structure, and outcome of physical therapy education, as well as how any group of faculty envision the present and the future practice of physical therapy. In using 5 philosophical orientation to develop a course, as we know, the curriculum consists of many courses. So to develop a course mean different course will build up the curriculum. So the teacher would first specify the goal of the course and then identify how much of each philosophical orientation will be used to help the student reach those goals. Going through the process of thinking about philosophical orientation related to the goal for each class can be eye-opening experience, which can guide teacher in re-opportunity classroom, re-preparing for the classroom and the laboratory time appropriately, according to the school student type, according to which theory he is going to apply in this class, or proportion for each theory, and so on.
Another course, it will be for a course of basic skills. The teacher wants a higher percentage of class time devoted to technology. For example, 60%. He wants to teach also how to think about applying basic skills in a wide variety of clinical situations. So, what he will doing? The teacher may plan to devote 20% of class time to stimulating cognitive processing reasoning, and finally, teacher might focus on some skills student will be able or needs to use immediately in clinical practice. Thus, the remaining 20% of the time might be used for elaboratory sessions organized around common clinical problems, in which students can learn basic skills that are immediately applicable in their next internship. Such a process can also ensure that all class time is not devoted inadvertently to a single philosophical orientation, or an orientation that doesn't have a current fit with the overall curriculum design.
From the cognitive learning theory, as Piaget established since so many years ago, from this work, he postulated that thinking and learning were bound to the child biological development. So cognitive learning theory not stopped at the level of Piaget, but become more advanced by someone called against. He suggests some point, and the focus in development of facts, knowledge of structure, concept, principles, and added also problem solving, that are critical element of clinical reasoning, which we consider when dealing with the clinical cases in problem solving as in a clinical class.
For example, students should be able to identify the muscle, nerve, and connective tissue involved in the shoulder rotator cuff. This is a fact. Before they can understand conceptually how these structures fit together. After they understand how the structures are related, they can understand the biomechanical principles involved in the rotator cuff mechanism. After understanding these principles, they can solve problems related to the motor rotator cuff injuries. If the student has missed any one of these steps, it would be difficult to proceed to the next step. Another example, if the student does not understand conceptually how the various tissue structures are related together, then it would be difficult to understand the biomechanics of movement.
So, from this discussion or explanation, we can find it is essential to know about cognitive learning theory, as it contains facts, mean knowledge, basic knowledge, and structure, and how to conceptualize these concepts to be understood or make as a part of function in problem solving. The principle is essential, and regarding to or depend on these three facts, concept, and the principle, we are going to solve the problem. So here we must emphasize four element is essential and important. We can't miss anyone when dealing with the problem solving. In order, we must have the all four. We must have the knowledge. This knowledge concepts to be functional or arranged in the process of problem solving, and the principle of whatever. Here the previous example related to facts about basic structure about anatomy, concepts, and then principle for the biomechanics, and then we are reaching for the patient. Our patient in clinic have a problem, a rotator cuff, or what is mentioned, and rotator cuff syndrome. So how we are going to dealing with such a problem? If we haven't the fact, if we haven't the concept, if we haven't the principle, how we are going to solve, how we are going to treat such a case? So must keep in mind all this principle, all this basic element of knowledge to apply, to solve, or to treat our patient in the clinic. These are critical elements of clinical reasoning. So here cognitive learning theory. Cognitive learning, how we can gain the learning through this theory. Learning is based on the mental process by which a learner take in and interpret it, store, and retrieve information. When we are going to recall this information by the stimulus. So the stimulus, cognitive process, lead to response by solving the problem. Building on the work of early theorists, one of the authors asserted that learner construct meaningful knowledge by being able to connect new concept or knowledge to what they are already know. So we have concept, so now we have to get new concept and the new knowledge, building on or accumulate above or what we already have before. Learner need to build that structure, not just have information poured in, not to have information and board, but we must learn how to use this information. So we can find the cognitive structure learner theory that began with Piaget observation in his own kids or children are very useful in thinking about way to organ and present information. For a teacher whose main philosophical orientation to a course is academic rationalism, the predominant learning theory of the choice should be Piaget cognitive structure. So when we are going to discuss each theory, we can find where we can place this theory. So to summarize our lecture for today, we are discuss 5 philosophical orientation in the form of developmental cognitive process, academic rationalism, technology, society interest in the form of social adaptation and social reconstruction, and the last one about 5 philosophical orientation was personal relevance.
Now it's time to remember the important points we have talking about. Number 1, teacher whose main philosophical orientation to a course is technology, the predominant learning theory of choice would be behaviorism. The second one, teacher whose main philosophical orientation to a course is development of cognitive processing reasoning, the predominant learning theory of choice would be the guest-led problem-solving experience. The last one, when the teacher whose main philosophical orientation to a course is academic rationalism, the predominant learning theory of choice would be Piaget cognitive structure. Don't forget.
Now it is the time to thank you for your listening and your time, and we appreciate that sending for us any question related to this lecture or the previous one. Again, thank you.
Thank you another time for listening.